Okay, so this is Kevin. I think you guys all know Kevin. And welcome again to our back pain and sciatica workshop. Kevin has been practicing physical therapy since 1991 and has had his own company here in Northborough since 2016. And we actually just opened our second clinic a month ago in Hudson. So Kevin, the floor is yours.
Thanks, Kim. I appreciate that. I appreciate everyone taking a couple of minutes to be on the call tonight, and looking forward to having you guys participate as much as possible. I'm much more of a fan of doing these in person because we end up our in-person events are more active. We get people moving around a little bit. It's a little bit more stationary here, but we'll do our best and we'll see how things go. So I'm going to try to share my screen, and Kim will let me know if I'm not doing well with that. Can you see the presentation, Kim?
Yep.
All right. And so this is pretty much our agenda for this evening. We're going to just go through some quick lower back statistics and then talk about the anatomy. We're going to focus on 3 problems that we have a tendency to see a lot of in the clinic. We're going to talk a little bit about posture and breathing. We'll talk about, should you stretch, should you strengthen? We talk a lot in our clinic about chronic pain, and then we'll get into some fitness goals. And we finish with just kind of talking about, is PT for you? Some people aren't really sure, and that's why we have the workshops, is that we want to educate you on you learning more about your back problem, and then seeing if physical therapy is something that would help you in the future. So as Kim mentioned, I'm a physical therapist. I graduated from Northeastern in 1991. I've been practicing for quite a few years. The past 5 with my own office. We've been able to grow to a second location in Hudson and have a really wonderful staff. I'm blessed to have a great office manager and a great office team and a great clinical staff. And one of the things that we focus a lot on is our clinical work on lower back pain, because we see it a lot in the office. We actually have, we're constantly doing some training, and we've partnered with a group that is out of Pennsylvania. And they have done a lot of teaching us a lot of great higher level manual therapy treatments. They're actually coming this weekend. So we're excited to have them be with us this weekend again to do more training. So for us, it's kind of always about learning and always trying to get a little bit better every day. So these are just some of the goals that I'm hoping to accomplish with our talk for tonight. Number 1, I want you all just to become a little bit more educated about lower back pain. 2, to realize that I don't think you need to live with severe lower back pain. 3, it's always good to get medical advice, not from the internet, not from your neighbor, but from a qualified professional like a physical therapist or a physician or a chiropractor. And there are plenty of other fish in the sea. I always joke when I do these presentations, we have great relationships with a lot of other providers, and one of them is acupuncture. My wife is a co-owner of an acupuncture clinic that's right next door to us. And so we do a lot of referrals back and forth. And so we're certainly not the only people that treat lower back pain, but there's others out there. And if you're always looking for something other than physical therapy, let us know. We can help you with that. And then we're going to finish tonight with 3 exercises that are super simple and basic to do, that everyone can do at the end of the program to start working on at home. And then I'm just going to finish our goal section just by saying we're recording the talk, and what we'll do is tonight we save the recording. Tomorrow or the weekend, we'll upload it to our YouTube channel, so then it's available for anyone to watch. So if you had a friend or a family member who couldn't make this, we'll send you an email by Monday at the latest with a copy of the link in it. And as well, we'll provide this presentation, and finally we'll give you those 3 exercises on paper. So we'll send that all to you by Monday the latest. So low back pain, it's a global crisis. Americans spend at least $50 billion every year on back pain. there are more cases of this number 3, that the third bullet on the slide. Most cases of back pain are mechanical or non-organic, means they're not from a serious condition like an inflammatory arthritis or from an infection or fracture or cancer. The strong majority of them are just musculoskeletal in nature. This is a classic study that that was done back in 1994. And I talk about this, and most people are like, well, 94, that was a long time ago. But a lot of people that come to see us, they do not have an MRI done. The doctors generally will send people to us first or to other providers to try care first before testing is done. And this is the reason why. So they had a general summary of this study was they had 100 people, and out of those 100 people, none of them had any back pain complaints, 0. They all generally were in relatively good health and no back pain. They all got an MRI. And when they came out of the MRI, they found that 52% of them had at least a bulging disc at one level, 27% had a protrusion, and 1% had an extrusion, which means the disc is actually is deformed and really in bad shape. 38% of those people had more than one level. So out of those 100 people, half of them, and even almost 3/4 of them, had problems at multiple levels. So we can all assume, everyone that's on this call, I'm assuming, has at least 50 candles on their glass birthday cake, right? And so out of those, all those 50 candles, that's a lot of degenerative change that happens in the spine. So we know that that's going to happen. And as a result of that, what we try to do is we'll work on making sure that we try to work on some things other than arthritis, because, you know, arthritis obviously is something we can't change, but we do a lot of other things to affect improvement despite the arthritis. So we'll just kind of move to talk a little bit about the anatomy of the lower back. And here's the spine. So this is a picture of your spine from the side. And there is 4 different segments. Today we're focusing on the lumbar segments and the sacral segments, and those are down the bottom. But obviously when we're talking about spine, we can't neglect the thoracic and the cervical regions. So there's 4 sections, but we'll focus today on lumbar and sacral regions. This is a picture of our spine kind of forward and back. Like if we were to, you know, lay on an x-ray table on your back, that's the picture that would be taken of your spine. So the spine on the left is a normal one that's straight. The spine on the right is one that has a lateral curve, or what we call a scoliosis. Luckily, I think for us, screening of scoliosis is much improved than it was many, many years ago. So we see less and less scoliosis over time. Kim, is there I think we're going to try to mute the call if that's okay.
Yeah. There we go.
Awesome. All right.
I can't hear you now.
How about now? Can you hear me okay?
I can hear you, yeah. Sorry.
All right. No, that's okay.
Usually does this.
That's all right. Here's our first problem that we generally see, and it's the fancy term for arthritis, and the spine is called spondylosis. Now, what you'll see on the left is a spine, and the upper section is a normal-looking disc and a normal-looking vertebrae. And as we go down from level to level to level, we'll see varying changes in what the disc looks like. So all the way to the bottom, where we see a lot of just really degenerative changes, it's actually what on X-ray they look for what they call a top hat. So if you look at that bottom segment, it looks like an actual top hat all the way down the bottom. that's bad. That's a really significantly arthritic spine. What we generally tend to see more of is the second level from the top, which is the degenerative disc, and then varying forms of either a bulging disc or a herniated disc or a disc that's thinned. So the majority of the people that we see with spine arthritis fall into these categories. They're generally over 50 candles. We see this more in women than in men. Their general complaints are of stiffness in the lower back, pain in the lower back, hips, butt, and sometimes in the thigh. And usually they're also very sedentary. So our first exercise we're going to talk about is the single knee to chest. So what I do for that, I'm going to show you, we have a really great home exercise program that I'm going to switch to. And I'm going to double click on this. Kim, can you see this guy doing single knee to chest?
Yeah.
Great. And so I'm just going to play the video.
On your back with your legs straight. Using your hands, slowly pull one knee toward your chest until you feel a gentle stretch in your lower back. Make sure to keep your back relaxed and flat on the ground during the stretch.
So very basic, simple stretch. Anyone that has any lower back stiffness, this is a fantastic one just to do laying right in bed. And so he's pulling his knee towards his chest. He holds it for about 20 seconds. He then releases it and does both sides. When you're doing it back and forth, we'd like to have people do about 5 on both sides. So there's your first exercise. So right away, you could easily try that tonight. And for those of you that are having some trouble getting up and down from the floor, we just generally recommend that you get on and do these on the bed. It's just much safer. If you can easily get up and down from the floor, then that's fine. But if you're having trouble with that, we'd rather see you get up and down from the bed instead. And again, like I mentioned, we'll send you all these exercises in a handout. But if you remember that one, that's a simple and easy one to try. Now, some people who have a lot of arthritis, like the lower sections there, will do both legs at the same time. So bring their both knees into their chest, hug their knees into their chest for that 20 seconds, and then do that 5 times. Now, so when we're looking at the spine again, there's a section in through here where the 2 vertebrae are stacked on top of each other, where there's a spine that's kind of aligned up and down like this, and it allows the joints to open and close, and that's called a facet joint. And we see that a lot with our patients that are less than in their 50s that have some spine issues. And sometimes some people that have had their back feel like they've kind of locked up on them. We do a lot of treatments to work on trying to unlock that spine as best as we can. And Kim, just want to make sure you can see my screen again. It says Spondylosis Treatment, correct?
Yep.
Great. So here in the picture on the right is just an MRI of what spondylosis would look like. So we can see the vertebrae are stacked on top of each other. We can see a white line that's almost in the middle of the picture. That white line is your spinal cord. And then the kind of darker lines in between each of the bones is the disc. So you can see where the circle is. There's 3 discs that are kind of popping out and pushing on that nerve. And that's a really common problem that people will have. The disc pushing on the nerve sends symptoms down the leg and ends up increasing the symptoms in the leg. So what do we do in physical therapy with these patients? Well, we talk a lot about postural retraining. We're teaching people how to engage their core muscles more. Over 50 candles, we lose core strength dramatically. So we work on trying to spend a lot of time talking about that. We spend a lot of time talking about pain management. We want to get the spine moving better. We teach people how to get stronger, how to strengthen their hips and strengthen their back and their core. And then we always do a lot of aerobic conditioning too as well. The second problem that we see a lot of is sciatica. And now sciatica can be of two origins, and that's why there's two pictures on the slide. So the picture on the left shows the sciatic nerve in its full length. So you can see it goes from the top part of the picture, from the pelvis, all the way down through the back of the leg, all the way down to the heel and down into the toes. So that yellow spaghetti looking string in the picture is the sciatic nerve. On the right side of the picture is that same kind of linguine-ish looking yellow spinal sciatic nerve and muscles that are surrounding it. So sometimes with the picture on the left, we can get compression of the sciatic nerve from the spine going down the leg. Sometimes we can get some compression from muscles in the hip, which might cause some symptoms down the leg. So the presentation of our patients with sciatica, generally over 35, they generally have low back pain. They usually also have some buttock, leg tingling, or numbness. And it's usually very specific, like they'll come in and say, the outside of my thigh is numb, or the top part of my thigh is painful, or I have a lot of pain in my heel. Usually difficulty with sleeping is very common, and they generally have poor posture, and they're just, again, sedentary with a lot of work. So the second exercise we're going to teach you guys is to stretch this muscle right in through here, this piriformis muscle. The piriformis muscle is a funny name, but what it does, it rotates the hip. And so sometimes it can get tight and stiff, and that tightness presses on the nerve and sends symptoms down the leg. So let's go back to my home exercise program again. And I'll show you that one. So you can see she's on her back, leg is crossed over the other leg.
Begin by lying on your back with both knees bent and feet resting flat on the ground. Cross one leg over the other so your foot is resting on your knee. Grab your leg just below the knee and slowly draw it toward your opposite shoulder until you feel a stretch in your buttocks. Do not allow your back to twist or bend excessively during the stretch.
So you can see how her knee comes more to the side, to the opposite side, not straight ahead like the first stretch did. So again, very simple stretch, very super easy. If you're not comfortable getting up from the floor, you're going to do it in the bed. So I can't keep emphasizing that enough. So what do we do with sciatica? So again, we're spending a lot of time talking about pain management. We do a lot of manual work to the lower back, to the hips areas on both sides. We do a lot of postural work and strength training. And then we also, in both of our offices, have the ability to do what we call lumbar traction. So lumbar traction, you can see from the top picture, is someone being harnessed into a table that we connect to a machine that creates traction and through the lower spine. And so usually this is a very, very comfortable treatment. And if you think about how all those vertebrae were compressing in the pictures we showed, well, what we do is we lay people down and we say, okay, let's create distraction between those vertebrae, takes pressure off the back. So I am probably asked a few times a week about inversion tables. I think everyone has seen, the infomercials about tables, and someone, gets on the table and they flip them all the way up and down. And so their feet are at the ceiling and their head is down to the floor. And my standard answer to inversion tables is I'm very much a fan of them. I will say, though, it's very important that they're used correctly, because I think sometimes the videos and things are a little bit kind of too much. If someone has a history of any heart trouble, any breathing concerns, any problems where, or any issues with dizziness, or just feeling unsettled in any way, inversion is not a good idea. If if you're on a lot of medications, if you're having issues with just general health and not feeling well, inversion is probably not the right thing for you. Young, healthy people that are relatively active, that have some degenerative lower back changes, inversion tables can be a very, very helpful thing, and something that we recommend all the time. The most important thing is, most people get on an inversion table with it being horizontal, and then they have a clicking lever that allows the table to invert in this fashion, so the feet are up top and the head is down below. I just want to make sure that they don't really go past about 30 degrees, 35 degrees. That's really all one needs to get very good distraction from the inversion table. Here's our third problem that we see a lot of, sacroiliac joint problems, or SI joint problems. You can see the picture on the left shows the spine at the top and then the pelvis on either side. And the lower kind of V-shaped bone here is called the sacrum. So the sacrum and the ilium of the pelvis make the sacroiliac joint. The majority of our clients that have an SI problem are usually 20 years or older. It tends to be more female than male. There usually is some childbirth issues in females, childbirth, or women that have had children can lead to some mobility issues in the pelvis. So the body of the female adapts when the female is pregnant to adjust for the size of the baby, and can create a lot of mobility and too much mobility issues in the lower part of the spine and in the pelvis. Most of these clients are having pain in the lower back and the buttocks. They have a lot of pain with sitting or standing, not usually in the leg. And our exercise that we do a lot of training with them is the posterior pelvic tilt. Let me show you that one. Now, you'll see again, she's on her back, knees are bent. I want you to make your focus on her hip and her pelvic area, almost where her hand is.
Begin by lying on your back with your knees bent and feet resting on the floor. Slowly bend your low back and tilt your pelvis backward into the floor. Then return to the starting position and repeat. Make sure to only move your pelvis and low back and keep the rest of your body relaxed.
So you can see it's a very subtle movement. It's not a lot of movement, but one of the things that if we could talk to her while she's doing it, she'll find that as she tilts her pelvis, she can feel her abdominal muscles kind of engage. So this is a great exercise, a very basic one, but a great one to help get those abdominal muscles more engaged. So this is generally an exercise that we'll do with women with the SI problem of pain. But a lot of times, almost every lower back patient that I see that has a need for some strength in the core, this is on my list of almost every lower back problem I see. So we spend a lot of time doing that posterior pelvic tilt. All right. How do we treat SI problems? Again, pain management. We talk a lot about breathing. We'll do some corrective postural exercises. This is a clam exercise that we'll do. This is strengthening the hip and the pelvis area. We do a lot of core stability work with them. And then we just talk a lot about what should you do and what should you not do. And honestly, crossing the legs with an SI problem is generally one of the things that we encourage people to avoid. So let's just take a minute and talk about posture. We'll talk a little bit about standing posture. I know a lot of you are on the computer on a daily basis. And I always joke, mom was right. When back in the day, when she told you to sit up straight, it's very important. Here is a variety of different postures. You can see the posture all the way to the right is someone in good kind of almost military-like standing posture. We don't encourage this posture all day long. It's near impossible. But we do encourage people to try to avoid we want them bringing their head back. We want them bringing their shoulders back. We want them avoiding this position and drawing in their core. These are all positions that we see people generally come into our clinic like, and we encourage more time spent in that better posture. So it all comes down to the lordosis. And you can see, and this young lady by the pool, how she has an extreme lordosis in her lower back. This gentleman here, because of too much cake off of all those candles, has an extreme lordosis in his lower back. And so we do a lot of work by that pelvic tilt to try and lower that arch and engage those abdominal muscles more. This lady in the middle here, you can see her back is relatively flat. So what we're looking for is not too much curve and not really straight, but somewhere in the middle. And by engaging that core and doing that tilt, we can get those muscles moving better and more engaged. So let's talk a little bit about sitting at the desk. And we see a lot of people that are at work now with COVID. We're seeing a lot of people working at home. People's workstations at home are makeshift at best. They're not really that great. And we have handouts where we encourage them to try and get into this position like the cartoon down the bottom. So you can see the gentleman has got good supportive chair. His arms are supportive. The screen is at his eye level. His feet are flat, really great looking posture. And with this, a picture above, what I generally talk to people is I'll say, the picture of the lady on the right is how we show up to the office at 8 o'clock in the morning. And the picture on the left is maybe about 2:30, 3 o'clock in the afternoon. So you can see we've got no support, bad posture in through here. Arms are hanging down, we're slouched, legs are crossed. I don't expect everyone to sit like the picture on the right all day long, but what we're hoping for is more time in better posture and less time in worse posture. Nowadays, there's a lot of adaptations that can be made to desks. Standing is now becoming a really popular thing at work, and we encourage a lot of standing. It just allows people to change their position. In our office, we use a device called FlexiSpot, and this is in its upright position, but at its lowered position, it allows someone to work at their desk in a sitting chair. But then when they get tired of that, they can stand up and they can raise this table up higher and they can stand and work at a standing table. The nice thing is nowadays, this device is about $200. So the prices of them have come down a lot. And a lot of times now with people now working more from home, we're encouraging our patients to try and see sometimes their bosses or their offices will cover the cost of that. Or if you have a home office that you use, this is obviously definitely a nice deduction on your taxes as an expense. So when I treat lower back problems, I'm asking myself two questions pretty much. Are they hypomobile or are they hypermobile? So someone who is in that hypomobile problem, they are very tight in the hips. They have that flat lordosis like the woman we saw in the middle picture. They don't breathe very well. They don't engage their core very well. Or we may see someone who is in this hypermobile position like the young lady on the computer upside down, too loose. Maybe they can overextend their joints. They consider themselves to be double jointed. They're like the girl in the pool who had the whole lordosis that was very high. They need help with strength and they need help learning how to engage their core. So another really common question we get, should I stretch? And, I'll say the answer to that is yes, if you're tight. And if we go back to this stage, the person who can't touch their toes, yeah, we're going to have them stretch. This young lady here, we're not going to probably have her stretch. She probably needs more exercise to get stronger. So there are varying ways to stretch. And there's also kind of some really neat devices to use to stretch. And we use them all in the clinic. You can see this woman in the top picture is using a foam roller to roll through her back. And the foam roller is a hard piece of foam that helps to loosen up the tissue just from rolling on it back and forth. Here is that single knee to chest that we had talked about before, guys doing it right on the floor. Over here, he's using a little lacrosse ball to help loosen up. You ever have that spot right in between your shoulder blades that gets tight and sore? We put that ball behind our back and we roll back and forth on it, and it does a great job loosening it up. And then another really common thing is this she's got a massage stick. And so she's using that stick to kind of roll. It's very much like a rolling pin. So, you know, we have our patients who are at home, we have them pull out the rolling pin and try that on some tight muscles, and it does a really nice job at loosening things up. So many times people say, well, should I stretch before? Should I stretch after? And my basic answer to that is do whatever feels good. Some people find that when they stretch before, it helps them loosen up. Some people find they're better off when they stretch after. And so you just got to try both. But honestly, the most important thing about our work with PT and low back pain, it really comes down to the core. And so you can see in the pictures, the core is multi-leveled. So there is, in this picture on the left, they've cut away certain segments to show that there are deep abdominal muscles that create stability in the spine. And then there's layers and layers of abdominal muscles that help to create stability. We're always trying to work on trying to get them all as strong as we possibly can. But when we talk about the core in our office, it's not just the front, the abdominals, but it's also the lower back. So here's a picture of the spine from the back. Here is the top of the pelvis on the right side. Here's the top of the pelvis on the left side. Up in here on the sides are the ribs. So you'll see there's these muscle groups in through here, multifidus and quadratus lumborum. They're really important postural strength muscles in the lower back. We do a lot of work to get them stronger. And then we can't strengthen the back without strengthening the hips. So we do a lot of work on the internal muscles of the buttock, and then we do a lot of work on the external muscles, the big glute muscles that when we think of the butt. So we're just going to take a minute and talk a little bit about chronic pain. We see, 95% of the people that we see in our office are having some complaint of pain. And I say to everyone that pain is normal. Our body's job is all about general response to pain and protection. So I use the example of the stove. So if you went into the kitchen in your house and you were talking to your spouse who was cooking something on the stove and you didn't think the stove was on, you went to put your hand on a hot stove, your body will never let you keep your hand on that stove. Your body will respond and guard or just get away from that hot stove as quickly as possible. And so a lot of times what we see in the clinic is people come in and they've just been guarding. They're just tightening up, and every time pain comes on, they react by, oh, it hurts. Oh, I can't move. And all that guarding just helps to increase their pain more than it is than just when they're resting. So we spend a lot of time working on trying to help them breathe and helping them educate them on the fact that that guarding and that all that tension is bad for your spine. It doesn't like it. And so if they can spend more time resting and recovering, that's going to be much more helpful in letting them get rid of their back pain long term than spending time in that position. And so the last thing on the page is what I call tweaky things. And people always laugh at me at this, but almost every day we see people in the clinic and they come in, they go, oh, geez, you know what? I had this sharp pain. It went down my arm and it just was a flash of pain and it lasted for 5 seconds and went away. And they'll be like, what was that? What do you think that was? And I'll be like, I don't know. I'm not really sure what it was. It's something that I call a tweaky thing. And they look at me like I'm crazy. But really what a tweaky thing is this weird kind of shooting discomfort that goes down the arm or the leg or one spot. And it just goes away. And again, something happened in our body for the body to try and protect itself. And by that, it gave you that shot of pain. So I only worry about tweaky things when they become trends. So if you come into my office and you say, you know what, that shooting pain's happening every day at 3 o'clock. I don't know what I'm doing, but it comes on, I can't get rid of it. Now we're concerned about it. But just random occasional pain things, very, very common. Think of this. We use the pain scale in our office. The pain scale is from 0 to 10. Anything from 0 to 3 is a very low level discomfort, is normal. All of us with 50 candles on our cake or more know that we wake up and we have some level of discomfort every day. That is normal. When pain creeps up to 4 to 6 in that range, that's when I get a little concerned. And I'm willing to let people kind of try to work through that, but we just never want it going past 7. So use that as kind of your frame of reference with your day. Is if everything is in that 0 to 3 level, good for you. That's right where we want to keep things. We just want to avoid it getting anywhere from 4 to 6 or even 7. And this is the cycle that we see with chronic pain all the time, you know? So if you look at the blue part of the circle, increased pain, right? It allows person to not enjoy life. They start worrying about work. Those things maybe lead to some anxiety with them, their general health. They're worrying more about their pain and their work and their life and family. They're not sleeping well. So maybe they have some relationship issues in their home. Maybe they're starting to over medicate or not medicate at all. And then they're just not coping with it. So they don't do anything about it. Maybe they go to the doctor just, oh, it's just back pain, get out of my office, and all of a sudden they're going to all these appointments, they're paying money out of pocket, they're not working because they're in pain, and they're just caught in this constant cycle of pain. It's bad. And we try to work on getting them out of the cycle by educating them that pain is normal, that we've got to get them out of that. And one of the best things for us to do is to start talking about breathing. And we do that by teaching them how to breathe from their diaphragm. So you'll see from the picture of the skeleton, and the red area and the diaphragm is noted to the left. It looks like a parachute. It's actually a muscle. We consider it to be the roof of the core. And so we can work on trying to strengthen that purely through breathing, believe it or not. So what we have people do is we have them just sit comfortably for a few minutes, placing one hand on their chest and one hand on their abdomen. And so this is another thing you can try a little bit later. A lot of the times when we think about breathing, we think about our lungs inflating and deflating this way, forward and back. But what I want you to think about is letting your lungs inflate and deflate by going up and down. And so what we should feel is as we breathe in, we want to feel our bottom hand expand. And when we breathe out, let that bottom hand fall. And a lot of times when we start, we feel the chest breathing this way a lot. And this here can lead to a lot of tightness in the chest, a lot of tightness in through the neck. So we get to try and get the chest to be relaxed and let the abdomen do all the work, which ends up allowing us to breathe. And the best thing with this, it allows someone to sit still for 4 to 5 minutes and just to be relaxed and quiet to try and get rid of some of that tightness in through their chest and get their breathing improved and getting them to be calm. Think about what pain happens. Pain comes on and we guard and we tighten up. That's constantly happening. We've got to get people to relax more, and breathing is a great way to get that started. So our goals for almost everyone is to combine some posture and flexibility work along with some aerobic work and along with some resistance training to maintain optimal health. For me, it doesn't matter the age. It could be 15, it could be 85. It really doesn't matter. We can all address posture during the day. We can all work on flexibility of our tight muscles during the day. We can all go for a walk. In the bad weather, you drive to the mall and you walk the mall. In the good weather, you get outside, get some fresh air, get some sunshine. And resistance training is just using some light bands or exercise balls or weights or something where we're working out to get our muscles more in tone. And these are all things that we strongly encourage in our sessions. So This is the point in the presentation where I present you the challenge. So what will you do? Everyone that's on this call, I'm assuming, is on the call because they have back pain or some type of discomfort in their back. And so there are generally three things that can happen. One of them is ignore, one of them is alter or change, one of them is handle. I'm going to share with you a story. One of a mentor of mine who is in Pennsylvania, part of this group that's coming up this weekend, shares this story all the time. And he talks about, he's a physical therapist. He has a clinic kind of like mine, and his office is in a strip mall. So there's 5 different suites in the office. And so one of his clients is in there and looks up at the ceiling and says, "Hey, Bob, you've got a ceiling tile that's leaking." And he's like, "Oh, all right." So he's like, he lets it go for a couple of weeks. The same patient's into the next week. "Bob, the ceiling tile's still leaking." He's like, "All right, fine. I got to do something about it." He ends up then going and goes to Home Depot. So his first part is, just ignore it. It'll go away. The second part is, you know what? Here's what I'm going to do. I'm going to Home Depot. I'm just going to replace the ceiling tile. It'll go away. Well, what happens? Strong rain happens, comes by, and what happens to the ceiling tile? There's another stain on it. Patient comes in, "Hey, Bob, your ceiling tile is still wet." So Bob then goes, "Okay, what do I got to do? I got to call the HVAC guy, my air conditioning guy." The air conditioning guy comes, and what does he say? Of course, "No, it's your roof." So he calls the roofing guy. The roofing guy comes, and what does he say? "Oh, it's not your roof, it's the HVAC guy." And we all have had that happen in our lives, right? So he's like, fine. He ends up having this other guy come who is a roof guy, and he's going up in the trusses and looking here and there and finding this. And he realizes that 3 suites over is where the leak is coming, but the way all the trusses are set up, the water is hitting them and end up leaking in his office. So we finally figured out he got the right guy in the right place who handled the situation and fixed it. And now he no longer is going to Home Depot buying any more ceiling tiles. He actually handled it. So that's my recommendation for you. I'm going to ask you to really think about what's going on with your back and why you're living with back pain. There's no reason for that. We have plenty of people in our world that can help you take care of that. And, you might go to the doctor. And I would encourage you to do that if your back is bothering. It's a great place to start. They're going to do their clinical exam. A lot of them locally that know us will recommend physical therapy. Keep in mind, they won't do an MRI unless you've had 6 weeks of sciatica. So don't even ask them, they won't even do it. And they won't give you pain medication. Nowadays, with the opioid crisis so strong, the last thing that they're going to do is recommend that. Now, what I hope that you don't hear is, don't worry, your back pain will go away. Because those of you that have had back pain before know it doesn't go away completely. It comes and goes. It's like, the ocean, the ebbs and flows of the water comes and goes. Back pain is the same way. If you came to our office, we assess you first. We talk to you about what are your goals, what's your problems, and then we formulate an individualized program to help you learn posture, strength, and endurance. And then we do a ton of work on balance. And as we get over 55 candles, we have to make sure that balance becomes an issue in almost everyone. So we have to make sure that we address that, and we do with our exercises. So how can we help you at Flaherty? So there are 2 things. One of them might be you talk to your doctor and they say, go get some PT. We can set you up with a physical therapy evaluation right now. And our office number is listed there. It's 508-393-9000. That's our number in Northborough. We also have an office that's in Hudson. It's 978-875-7500. I need to update my slides. We can help you figure out what your insurance issues are. We have some great office staff that Kim manages for me, and they do a great job at helping you determine that. And then we'll get you in for an evaluation, get you started. We're working with one of my therapists to get you going in the right direction. We also offer what we call a free screen. So a free screen is not quite as detailed as an evaluation. It's a half-hour session, and we have you fill out some paperwork. We ask you to come in. We'll do a couple of tests on you. We'll talk to you about what your issues are. And generally one of three things will come of that visit. One is we'll teach you some things to start trying at home exercise-wise. And sometimes that's all you need, is just to learn some specifics to help you get in the right direction. The second thing that may happen is we might recommend some physical therapy. And so we'll send that screen to your doctor and say, hey, doc, we did a free screen on your patient. This is what we found. The third thing that we may end up doing is we may end up sending you back to the doctor. And we actually had a patient that came in not long ago. She recently had knee replacements 2 years ago, had just recently had some neck surgery, and she's having pain in her knees. And we were like, you know what? Let's get some clearance from your doctor first about your neck before we start doing anything with your knees. But that's what the screen is all about, just to determine where are things at and where we need to do to fix, help fix. So what I'd like to do, I want to, again, thanks everyone for coming. What I'd like to do is Kim, if you can, we're going to try and unmute everybody, and I'll stop sharing my screen, and we'll see if anyone has any questions. We'll do that next, and then if anyone has any questions, feel free to just kind of throw them out there. We'll try to answer them. If no one has any questions, then what we'll do is we'll encourage you all to have an awesome night, and call us if there's anything we can do to help. You know, we have the 2 offices now, one in Northborough, one in Hudson, and we'd be happy to try and help get your back going in the right direction. Actually, I'm gonna, I see this one message in the chat. Can you address what to do when you're having back pain after standing for extended periods? Knees are bent, but sometimes back feels like it locks up. That's a great question. So, you know, that exercise that we talked about with you laying down and engaging your core muscles, that posterior pelvic tilt is an awesome one to try. It's easiest done on your back, flat. But as you get more advanced with it, by being able to stand and engage your core muscles, that is a nice way to help taking pressure off your back when you have to stand for long periods. But having your knees slightly bent is a great way to help taking some pressure off the back. And then obviously, you know, trying to, you know, if you can avoid too long of standing and occasionally sit down, that can be really helpful as well. Good question. Oh, Micah said thank you. Awesome, good. All right, anyone else with any questions or concerns? So awesome. Well, thanks very much for coming. Like I said, we'll have this, we're going to save this presentation. We'll send you all an email as a follow-up with the link, so that way if you missed any part of it, you can go back and check it out. And you can always feel free to just pass along the information to anyone else if you like. And we hope you all have a great night.
Thank you.
Thank you.
Thank you.
Bye now.
Thank you. Thank you very much.
Thank you, Kevin.